Well, hi there. It is Marian, and I am so happy to be with you. It is Monday, so it is Monday Moves with Marian. This is something I'm going to be bringing you every Monday, a special exercise to go through, and I am giving you all the secret tips that I give to my patients so you can fine tune these exercises and get back to exactly what you want to do with all your goals, all your exercises, all of your activities of daily living. These are the tweaks as a cancer movement therapist that I teach to my patients so we get them better, faster, and feeling happier and way more in control. So let's take a look at the Delphine Dowel exercise. This is the one I'd like to share with you today, and this is a level 1+ exercise. The 1 means that it's something that you can do right after surgery. Of course, I want you to get the consent from your healthcare practitioner, from your surgeon or oncologist to ensure that you are safe to proceed with exercise. But being a level 1, this is something that is not going to affect the shoulders, it's not going to pull through the pectoral region. So from that standpoint, it's something that can be done right away, even if you have a restriction with the shoulder. It's a plus because it's got an added little twist in there for stability. So I'll explain that to you as we look through. So let's take a look at the Delphine Dowel exercise. This is actually a video of me demonstrating the exercise to a patient of mine. So we're going to start this. And before we even get too far, I'm going to stop right away. And I'm going to point out one of the secrets. I am flexing my wrists right at the bottom. So from a mobility standpoint, we see that we've got wrist flexion. This keenly important. Why? I'm getting an awesome stretch through the arms. This is good not only for mobility, but if you have tightness in the fascia, this is definitely going to help. Fascia, when it's tight, is going to affect your range of motion or mobility, not only in this area in the wrists, but also through the elbows and through the shoulders as well. So we really want to have that fascia nice and loose, which we're going to get with that wrist flexion. The other reason is you are going to decrease your risk of lymphedema by increasing this movement, by increasing the mobility through this area. We get much more fluid flow because we have an area that's not as tight. So this is really important. So let's start this again, and you're going to see as we move through, I'm extending those wrists as I'm bringing this dowel right up to the top. This dowel doesn't weigh anything, not even a pound. This is not a strengthening exercise. This is a mobility exercise. So as I'm bringing that dowel up, I'm flexing through in the elbows here. So I'm working on mobility. And as you can see, little secret, we've got the wrists extended at the top. I want this stretch through the other side of my arms now. So that's why at the bottom I had that overhand grip so I can extend those wrists at the top while I'm flexing those elbows. Now the other thing I want to show you is I've got these elbows in nice and tight to the side. That's the plus. In order to keep the elbows in, I have to use my stabilizers in the upper back. So it may be really hard at the beginning to keep those elbows tight in at the side, but it's something that you can work on. And again, we're looking for progression. We are not looking for perfection. Just like I said, progression, not perfection. So as we go through, I want you to note that the dowel is moving nice and slowly. This is not for speed, it's for training the body on how to move. You see now that flexion of those wrists at the bottom, but I want to point something out as well. Take a look at that dowel. It's not too straight, is it? If we zoom back here, let me see if I can do that. I am going to bring that back up to the top if I can. Boom, 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 boom. Oh yeah, that's nice and straight. That dowel looks great up here, but as we bring that back down, it's not straight. So as a cancer movement therapist, that's what I'm looking for. Asymmetries with movement. So I'm going to ask myself, why? Why am I okay at the top, not at the bottom? So number one, Great exercise for me. I'm going to keep going on this. But after 5 shoulder surgeries, I may have some issues that I need to work on. So I'm going to point these out to you. Look at this elbow here. We've got the front pointing right out. We don't have that over here. The front of that elbow is pointing towards my side. So if I bring that up a little bit, which I would do, I'm looking at the joints here. This shoulder's nice and squared off to the front, and we can see some roundness in here. So this is something I can work on and try and progress and get it going a little better. So I'm going to run through this again just so you can see wrists extending as I get to the top, pausing here, elbows close into the side, and now I'm bringing the dowel down, and I'm going to bring that down nice and slowly as I go through. Fantastic. And I'm back with you. Yay, I'm just learning how to use this software as well. So bear with me on this, but I think it's really important because I want to point out those secrets. I want to point out what I look for with my patients when they're at the gym with me, when we're doing a Zoom call and they're demonstrating an exercise. This is what I'm looking for and this is what I'm tweaking. Those tweaks are the difference between doing an exercise and doing an exercise well. I want you to do it well because when you do your other activities, whether you're out shopping, whether you're swimming, whether you are going on a vacation, those tweaks, the pain, those issues that you're going to have, these tweaks are going to take you through the exercise and get you to that next level. And that's what I want to see with this. So as I bear through here and try one more sneaky little thing with my software, yay, I think I did it. I want you to subscribe to my YouTube channel. I want you to take a look at these Monday moves. I want you to see them. I want you to try them. And again, always with consent from your healthcare professional so you know exactly what you're doing. If you have any questions, by all means, send me an email, send me a DM, and I am more than happy to help. Take care and have an awesome day.